Hello, everyone, and welcome to another session of our Facebook Live. My name is Saida Swale, coming to you from Congo, Brazzaville, at our WHO Africa Regional Office. And today we are talking about Ebola. Ebola is one of the world's deadliest viral diseases that has affected families, communities, and frontline workers across Africa and beyond. On this Facebook Live, we talk about what Ebola is, how it spreads, and the simple but powerful ways we can protect ourselves and each other. With me today is Dr. Patrick Otim, but I'll let him introduce himself. Welcome.
Thank you very much, Saida. My name's Dr. Tim Patrick. I am the Regional Manager for Emergencies Response at WHO Africa. And it's a pleasure to speak to you and the audience today.
Thank you very much for making time for this. So to start off this conversation, we want to know, what is Ebola virus and why is it considered very dangerous?
So Ebola virus is rare but very often fatal virus. It belongs to what we call the Ortho-Ebola viruses family. And we have 3 strains of Ebola virus that has caused outbreaks that we know of. So the first one is what we call the Ebola Zaire. And then the second one is what we call the Sudan virus. And the third is the Bundibujo virus that we are responding currently to. It's considered serious because it can cause severe disease that spreads from person to person quickly and can often result in death if it is not detected early and the treatment initiated quickly. And in some of the outbreaks, we have seen the case fatality ratio, that is the number of people who are infected who die, starting from like 20% and going as high as 90%. So that's why it's considered to be very serious.
Okay. You mentioned the issue of spreading. How does Ebola actually spread? We've seen some people who are now looking for masks to protect themselves from Ebola. How does it spread?
So Ebola is primarily spread through contact. So you have to come in contact with an infected person or their bodily fluids or the body of somebody who died from Ebola. Now let me explain this a little bit. So when you come in contact with someone who has Ebola, we have what is called incubation period. So it takes you between 2 to 21 days for you to develop symptoms. Now a person who has Ebola can only pass it to another person when they have symptoms. So when they develop symptoms. And then when they have that symptom, somebody who comes in contact with them, touches them or the fluids from their body, their blood, or even the body of somebody who died, can then catch the virus and go on later to develop the disease.
Okay. And what would these symptoms be? And would they vary from strain to strain, or it cuts across?
So the symptoms for Ebola are varied. So we have usually like 3 phases. The first phase, the early phase, is very difficult to differentiate because it presents with symptoms that are common for some of the tropical diseases that we know, malaria or typhoid. These include sudden high fever. It includes headache, joint pain, sore throat. It includes body weakness. And these are very common symptoms that everybody can have. Then after that, they can go on to develop what we call the wet symptoms, the second phase, where you have diarrhea, vomiting. And that's a very serious phase because of the level of diarrhea and vomiting that people can die quickly. From that phase, they now develop complications. And the complications include kidney failure. It includes maybe failure of the heart or muscles or the brain. And then in a few cases, we have bleeding. That's why we call them viral hemorrhagic fever, because there's bleeding. Now, bleeding is not very common like for the Bundibujo. It occurs in a low proportion of patients if you compare it with the Ebola Zaire or the Sudan, but it does occur.
Okay. So, in your opinion and in your expertise, who would you say is mostly at risk of getting Ebola?
So Ebola is a zoonotic disease. So first it starts from the reservoirs of the virus are wild animals. So for the first outbreak to occur, the people who are at risk most are those in contact or involved in activities that bring them in contact with wild animals. It can be hunters, it can be farmers. So those who are in that context, and those who maybe eat wild bush meat or things like fruit bat. So those are the first category. Now, if the person who catches the first virus from the wild has come home and become sick, The next category of high risk is now the caregivers at home, the people who will take care of this person. Then the second is the healthcare workers. When they go to the health facility, the healthcare workers will take care of them. And then lastly, those who participate in burials, because the body of somebody who has died from Ebola is very, very infectious, and people can catch, given our religious and cultural practices, people can catch the virus quickly. So those are the risk categories.
Okay. And that brings me to my next question. How is the treatment procedure when it comes to Ebola and the care of patients? What is currently available?
So because of the different types of the strains that I talked about, so we have different levels of care that's particularly treatments that are available. So I will classify those. There's what is general, which is for all of them, what we call optimized supportive care. So you need to provide supportive care. These symptoms I described, you need to be able to manage them. If they have diarrhea, if they are vomiting, so you replace the fluids aggressively so that they don't go into dehydration. So the optimized supportive care is available for all the strains of the virus, and it has been shown to improve the chances of survival. But it must be initiated early. So if the person is starting with headache and what we catch at that point, we start managing the headache, the body pain, and then when they start having the diarrhea and vomiting, we replace the fluids. So we prevent them from going into complication. However, if you take, for instance, the Ebola Zaire strain, we have antibodies, monoclonal antibodies that have been developed, which can be given to the patients to help them to recover. But that is not available for the other strains of the Ebola virus. But the bottom line is the early, aggressive, optimized supportive care, which also increases the survival.
Okay. Are there vaccines that are currently available for Ebola?
So also it applies to the strain. So when we talk broadly in Ebola, we can say that the vaccine is available for one strain. That is the Ebola Zaire. That's the one for which we have approved vaccines. For the Sudan virus, we started doing a clinical trial of a candidate vaccine in the last outbreak in Uganda. For the Bundibujo virus, we currently do not have any approved vaccine, and we are just discussing with the scientists to see if there's any candidate vaccine that can advance in clinical trial for this. So the answer is yes and no. Yes for the Ebola Zaire, but for the other two, no, we do not have vaccines currently available.
Very well put. And what would you say would be the simple steps people can take to protect themselves from Ebola?
So the first major step is that if you're in an area where there's an outbreak, that you need to equip yourself with the right information. What is the disease? How is it spread? Then when you know that it is spread through contact, when you come in contact with the body fluids of a person who is infected, or even their clothing or the surrounding, the first step is hand hygiene. It's very, very important, making sure that you maintain hand hygiene. You wash your hands frequently with soap and water so that you do not transfer the germs that you touch with your hands, then to infect yourself. Number two is then you need to avoid coming in contact with people who are sick. So if there is someone sick, they need to be referred to the health facility as soon as possible, where the healthcare workers are trained and they have the appropriate PPE that they can put on and manage this person. Number three, do not participate in burials of somebody who has died for Ebola, because that's the easiest way to catch it. And then number four, for those who are in zones where there's wild animals and those who engage in those hunting and work, we always advise that if you are a hunter and you find an animal which died on its own in the bush, don't touch it and don't bring it home, because it could have died of a serious disease like Ebola. And when you pick it, you bring it home, then you can be able to catch. The last one is that if we have an outbreak and there's a vaccine that has been presented, like we have for the Ebola Zaire, and maybe if we get a new candidate vaccine to be administered, that you accept the vaccine, because we have seen that the vaccine does help prevent and interrupt transmission. So those are very, very important. Lastly, there are those who will be identified as contacts. When you're identified as a contact, you will be advised to stay at home and not to travel. You need to obey and follow those public health measures, because it helps to stop the spread of the disease. It helps to protect your family and also the rest of the public from the disease.
Okay. So one would wonder, why does Ebola outbreaks spread so quickly in some communities and not so quickly in others?
So there are practices that would help amplify, what we call amplified transmission. And because, like I said, the person who will spread is the one who has symptoms. If somebody is sick and they are at home, they don't go to a facility where they will be isolated. And this person is cared for by many people. And they move from one clinic to the other. They move to a traditional healer. They move to a religious person to pray for them. All this contact is increasing how the virus spreads. So that is one. Two, burial practices. We have seen in some outbreaks where one funeral, the way people prepare the body, either according to religious or cultural practices, very many people participate in that. So one funeral can result in 40, 50 infections. So those are some of the things that help drive the transmission. So it is the contact, how people are interacting. It is the late seeking of care. People don't come to the facilities quickly. And it is the cultural and religious practices which help amplify the transmission.
Okay.
Yeah.
I'd like to take you back a bit on the element of hand washing. Why is hand washing such an important element during an Ebola outbreak?
So hand hygiene is very, very important because for you to get infected, one of the most vulnerable areas in your body is your eyes, your nose, and your mouth. Because that's where the lining of your body, what we call the membrane, is very thin. So usually we are touching something and unconsciously, or you touch your face, you rub your nose. So you are transferring the virus from where you had picked it and now introducing it into your body. And that's why we always advise that you have to wash your hands. And also, more importantly, for healthcare workers, we have what is called the WHO 5 moments of hand washing, which you must practice before touching a patient, after touching a patient, before coming in contact with the environment of the patient, or after touching the beddings of the patient, before doing any intravenous procedure like putting a cannula, injecting a patient, you must wash your hands. So you must follow all those moments if you are a healthcare worker. If you are somebody who is not a healthcare worker, you must always be conscious, wash your hands. If you have interacted with people, you have gone somewhere, wash your hands so that you can reduce the risk of transmission. It's not the only way, but it's also one of the ways in which you can reduce the risk of transmission.
Okay.
Yeah.
Are the strains of Ebola found in Africa any different from the ones found elsewhere?
So the strain of the Ebola virus is the same and it's distributed, but sometimes in terms of what we call the ecology, because it goes with the reservoir. The viruses stay in some animals which are reservoirs. One of them is the fruit-eating bat. It's a common reservoir for the virus. So, and this is distributed across different ecological zones. So what has been happening is that the viruses are identified in different locations. Sometimes it's not that it's the only one available, but it's the one that has been identified. But the distribution is largely, if you've seen across Africa, stretching from west, central, and going towards the Western Africa, in more towards the area where you have the dense forest vegetations, because those where the bats are, where they eat the wild fruits, and when they migrate with these viruses. That's how they get introduced to new locations. But so far, the ones that have been known to cause the outbreaks, they are distributed in these areas. That's why you see the one which was identified in Uganda, which is called Budibujo, is now causing outbreak in DRC. The one that was called the Sudan virus, which was identified in South Sudan in 1976, is caused an outbreak recently in Uganda called the Sudan virus. So the virus is not defined that you must stay here. They move according to the pattern of the reservoirs that carry them, which are the fruit-eating bats and other wild mammals. Yeah.
Okay. So that the viewers or our audience can understand, there is talk that the Bundibugyo virus, especially now, has shown instances where it's spreading very fast. Is this very alarming, and what should people do?
So I think we will have to do some transmission studies to see whether it is spreading very fast. I think the issue is that the outbreak has been going on for some time and it was not detected. Now, when you don't put public health measures to control the spread, the disease will continue to spread in the community. So it was irrespective of whether it was the Bundibujo, the Sudan, or the Zaire, it would have been spreading the same way if we had not put public health measures because it was detected late. And now that it has been detected and the measures that are being put in place will slow down the transmission. Now, there's one thing that I wanted to clarify, Saida, that because this virus has not occurred very frequently, it was a little bit difficult to detect because some of the tests we have in the field was for other types of other strains of Ebola virus. That's one of the things that contributed also to this. And also because this one doesn't present frequently with bleeding, people were thinking it could be malaria, it could be typhoid. So the clinicians were thinking of other things. And some of the patients, like those who went to seek care in Uganda, were developing renal kidney problems. And so it was only towards the end when people suspected that this could be some viral hemorrhagic fever. So because it doesn't show clear separate sign that this is Ebola, it's very easy to miss it if you don't test in advanced PCR testing that can identify for you that this is Ebola.
Okay. So WHO is on the ground, and in some places, WHO never left. So how is WHO helping countries respond to Ebola outbreaks?
So as WHO, we are as a member state organization, our responsibility is to support the member states to develop capacity for detection and response to these kinds of emergencies. And Ebola is one of the emergencies, the outbreaks that we take very, very serious. And yes, in different parts of TRC, we have field offices, and we have been working from the very first day with the provincial authorities in Ituri to be able to investigate. Now, in this context, we usually work in five broad areas which we are supporting. First is the emergency coordination, because for you to do this kind of response, there are so many actors, so many different parts. You need to bring everybody together, different pillars, those doing investigation. So you need to bring them together and make sure the response is organized and properly sequenced so that you don't have confusion. So we are working with the authorities in DRC and in Uganda on this coordination at the national level, but also at the global level, so that we can bring scientists together to generate the evidence for vaccines and for others that need to be tried. And that's what we are doing. The second issue is about community protection, because the communities are the ones that will stop this outbreak. How do we pass the right message? How do we bring the leaders, the influencers, the religious leaders, the traditional healers who are very influential as well in the community, so that we can all work together to stop this outbreak? So how do we do infection prevention and control in the community? How do we do safe and dignified burial so that we follow the cultural practices, but we do it in a way that is safe, that doesn't the transmission? Number three is the issue of countermeasures. So for you to respond to Ebola, you need personal protective equipment for the healthcare workers. Like now in DRC, we have delivered 17 tons of supplies that are required to set up treatment centers, to manage the cases, to give this optimized supportive care that we are talking about. So we need to get those supplies. If there was a vaccine, we would take it on ground. If there are any therapeutics, we take them. But now we are providing the essential medicines that is needed to manage the pain, the fever, all these other things that the patients are presenting with. Number four is then the issue of collaborative surveillance. We need to quickly identify who is the case, who is the contact. The contact listing and follow-up. You must follow a contact for 21 days. You must have teams. Now in DRC, they have already listed close to 800 contacts. So you have to follow them daily for 21 days. And if they develop symptoms, you pick them quickly, you take them to treatment centers. So that's a very important one. And then lastly is the issue of safe and scalable care. How do we care for the people? So the disease kills if you don't start treatment early, and you have to initiate treatment early. So we are working now, even with the partners, to make sure that we have treatment and isolation and treatment centers in all the affected health zones, so that it is close to the community and people can be brought quickly to the treatment centers, but also that as we do that, the healthcare workers are protected. It has to be safe care. So they need all the equipment that they can use to protect themselves first as they care for the community. So across those five areas, that's what we're working on. But also I will add that as we do that in DRC and Uganda, in the areas that are impacted, we are also supporting the countries around to get ready so that if there's any case, they can also detect and confirm and respond quickly. And that is being done across the neighboring countries. And the DG has also shared information as part of the Declaration of Public Health of International Concern with the entire world on how countries that are not neighboring DRC need to also prepare themselves so that if there's any case, they can detect and respond safely.
Okay.
Yeah.
So, lastly, with the panic that is there currently, I would like to give you this opportunity to give reassuring words and just assuring the public that there's already work being done and everything is in control for now. Yes.
Thank you, Saida. So, as somebody who has worked in Ebola
Yeah.
for a very long time and in a response, I do understand the fear that the name of the disease stalks because people have seen on videos and things what happens. But we have also, as a public health community, learned a lot about how to control this disease. Now, the first ingredient that we need is the community that owns the response. They lead it, they participate, they understand, they collaborate with us. If the community does not collaborate, they don't take up the measures that we are putting in place, all the knowledge that we have will not work. So the first thing is we ask for the acceptance of the public health measures, the participation, and then we can be able to move. The second one then is that, yes, we know what to do, and the respondents at the field are doing exactly that to quickly identify the cases, to quickly follow the contacts, to make sure that they are cared for so that they survive, because it's possible to get Ebola and to survive and go back to the families. So the assurance I can give is that DRC, this is the 17th outbreak that they are dealing with. So they know, they have the experience. And even the last one, which was there last year, was controlled within 87 days. So we need to give them the support that they need, and we don't need to panic. Don't need to cause tensions, closure of borders, and all these things. We need to ensure that what they need is flowing into the country. And if we give them all the support that they require, they can be able to stop this outbreak.
Thank you very much, Dr. Patrick. I hope you've learned something. If you've learned anything, please share with those around you. And thank you very much for staying tuned.